non-carceral responses, the kinds of interventions that actually promote community safety. And so we have two panelists with us. We have first Jillian Burford, who is a DC native, so right here at home. She organizes from a Black queer feminist lens. She is the policy organizer for Harriet's Wildest Dreams, which is a Black-led abolitionist community defense hub working to improve the material conditions of Black folks across the DC area. Through her work at Harriet's Wildest Dreams, she's the lead organizer for the Ella's Emancipators Pillar, engaging in political and civic education in the spirit of the late, great Ella Josephine Baker. She is currently pursuing her master's in social work at Howard University.
All right.
Yes. And second, we have with us Freedom Lisa Jones. Freedom Lisa Jones is the Director of Community Violence Intervention Programs for LifeBridge Health's Center for Hope, and also she's the founder and CEO of Street Paws Incorporated. She is a seasoned community advocate with over 20 years of experience as a strategist, professional trainer, and consultant. Freedom is a driven and skilled visionary. She has extensive nonprofit management experience and has addressed social, economic, and community health issues. Through her passion and commitment to our people living in underserved neighborhoods in New York and now Baltimore, Freedom has established strong community partnerships and has been able to make a meaningful impact towards social change. She's also very proud of her participation in the inaugural cohort of the University of Chicago Crime Labs community. So we have a number of U of C connects here. Please welcome our two panelists for this session, Freedom Lisa Jones and Jillian Burford. So we have a limited amount of time, and so I wanted to just dive into a question that I'm sure is on the minds of those who are here with us today, and that is specifically what non-carceral community safety programs have worked in your community, in your organization. You're both doing this work on the ground, and so people want to know, what are you doing that's actually working?
I'll jump in real quick. The first thing I want you to do is write down, because I see a lot of you are taking notes. Write down, public safety does not mean only the police. So you need to have that in your language and speak it all the time. So what are we doing in Baltimore? Greg Jackson from the White House and Rod recently visited us. And Baltimore, we're really happy because Greg was quoted. Baltimore is the greatest success story in the nation reducing violence. And what does that look like on the ground? My day job is currently, I oversee CVI programs, which include about 50 to 60 men and women on the streets doing intervention work, prevention and intervention work, street teams. I have 2 hospital violence intervention programs that are comprehensive. They see at bedside, gunshot, human trafficking, sexual abuse, all the trauma entry points that come into a hospital. I have mental health programs that are doing preventive work. For example, we have a youth radio station in our Safe Streets, which is our street intervention team, which young people talk about solutions in a particular catchment area, but because they're talking about solutions, all this trauma is coming up. And what we recognize is that you're talking about trauma, but how are you and your family being addressed and being restored as a result to dealing with trauma? So it looks like having resources to deal with from a mental health restorative component on the streets doing this work. It looks like having support groups. It looks like having a mini ecosystem that provides pathways out of the violence that has plagued our communities. We're doing this work using a public health approach. It looks like having a healthcare system change its policies to reflect staff. All these staff are in this healthcare system, I'm gonna talk real quick, who have come to this work with a lot of trauma and are forced and are doing this work because of their trauma and are succeeding in that. It looks like going to the White House and saying, you know what, these men and women who have done this work need to be like the police department, at least have administrative leave with duty because they've seen 5 shootings and have not had the proper care to be able to leave work after they're now full of trauma and having to go back into that work with pay that helps them heal. It looks like doing this work and leveraging the dollars to support the successes. So we're doing something right because we're seeing CVI work as an alternative. Another thing that I'm wearing my other hat is looking at an alternative to calling the police. As a result of being on the street myself, doing this work, I heard, saw, and lived people saying, I don't want to call the police. When the police showed up for a DVI issue, the folks who were impacted by the DVI issue got arrested. The folks who were experiencing the trauma were arrested. So they didn't want to call the police. They called 911 and got caught in a system that referred them to several different departments, and they got lost. So what I saw was what solution needed to be developed. So I'm developing this thing called Street Pause. Street Pause is an alternative now that is being beta tested and tested in the data space, in the digital space in Baltimore. We've hired digital violence responders. Digital violence responders who are looking at the digital space and escalating, because we know social media and our young folks, their violence is now happening in the digital space, right? And so what we are doing now is hiring people who are in that digital space, intervening, and also developing peace campaigns to address the surge of violence that is happening in that space. But what happens as a result of that stuff in that space that on the ground? Well, you have to have a solution to be able to escalate that to a call center, a trained person who can handle that call, and then connect with a trained street team to intervene in the street. I've talked to some athletes who have in the digital space who have missed a kick and had death threats. So we're testing ground deployment based on a digital escalation as a first service entry as an alternative to changing 911. We're also looking at the trauma that is in the digital space from a restorative practice, a restorative concept to say, if you're in that digital space and you are experiencing trauma, who do you call? How do you get help? Well, you can escalate that to the call center, and then there will be an appropriate deployment that will serve and connect with you around a restorative practice. So we're doing some of that good stuff in Baltimore, and I'm going to hush and move on. Don't forget to write that down.
You got it.
So here in DC, there are a number of things, but I'm just going to reference a couple organizations and community safety programs. For starters, at Harriet's Wildest Dreams, we are an abolitionist community defense hub, and under Ella's Emancipators, the work that I do is educating folks and pushing folks to think bigger and beyond the carceral system. Just last night, we had an info session, and we pushed people to imagine a world without mass incarceration, and folks simply said, they just want to go out frolicking in a field, pick up woodworking and simple things like that, where they don't have to worry about, if I need to call someone for assistance and for help, the police are going to arrive and I'm going to get locked up. We also have our Harriet's Responders pillar, which provides mutual aid service, but it also has our DC Safety Squad. And our DC Safety Squad has actually trained over 100 DC residents in de-escalation techniques and practices, and currently working out to build a hotline for alternative response, and training coming up over the summer while the date is to be determined. They've also just shown up on the scene at police shootings, just simply to be there for the community and provide a physical presence of safety. But we also have our I to Be Free pillar, which my own family has benefited from. Before I even started at Harriet's Wildest Dreams, the I to Be Free pillar actually helped assist my cousin in his law proceeding and got him less time. So this shows up in the form of Court Watch, where simply just being a body is beneficial because that is a form of mutual aid as well. We also have 15 org partners within the DC Safety Squad. But another organization I want to shout out is HIPS, which provides harm reduction experts providing improving lives since 1993. So as long as I've been alive.
I love it.
And so through this work, they actually operate a drop-in service center, and I'm going to actually read off the list of things that they do for harm reduction. That is syringe access and disposal, overdose education and prevention materials, safe sex education and materials, harm reduction counseling, linking clients to care services, clinical services, which includes opioid treatments, infectious disease, primary care, first aid, emergency response, evening clinics, and behavioral health. They also provide housing services, legal clinics, peer support groups, and behavioral health groups, and also substance use treatment. There's definitely an overlap between mental health issues and substance use disorders that we cannot ignore, and we just can't. Also, as Thea stated before, summer youth employment programs, we have that here in DC. Marion Barry actually brought that about to lower the violence that's been happening in the city, and I'm a beneficiary of that service as well. We also have Community Mediation DC, which provides free mediation process to empower people to create their own solutions to conflict. They have trained a few safety squad members as well. They provide they have a reentry program, mediation in terms of like individuals, co-parenting, workplace discrimination, and things like that. Conflict management workshops, mediation trainings. Here we also have Violence Interrupters, which is a pilot public safety program aimed to reduce gun violence, and is through the Office of the Attorney General. They've done outreach workers, violence interrupters de-escalate conflicts through mediation, focused on building relationships with community members to detect and prevent conflict and shootings, and it launched in summer 2018 under Cure the Streets. In December 2019, they added 4 additional sites. By January 2020, there were 6 operational sites, and they also added an additional 4. They have programs in pretty much all over the city. One of our primary partners is actually the Trigger Project, which aims to denormalize and destigmatize gun violence. So they actually take an approach of public health versus carceral. And it actually stands for, which I love the acronym, True Reasons I Grabbed the Gun Evolved from Risk. Because they actually recognize that all too often we are products of our environment, and when our environment is negative, we thrive in that negativity. So we actually have to change and shift. And so they actually just recently held a citywide gun violence conference where over 50 community-based organizations and stakeholders came together to assess gun violence as a public health crisis and co-create a citywide community peace plan. And through my work with Harriet's Wildest Dreams, we are also a member of the DC Crisis Response Coalition, where we are currently working to build out mental health professionals as first responders. I wish I could remember exactly when this happened, but it was a few months ago where a man who actually was in a mental health crisis was shot and killed by DC police on the way to the hospital. And in my experience, I've actually witnessed an incident myself while in undergrad in New York, where a woman came into a family residence shelter because housing is very much connected to these issues. She came in and she was threatening to harm herself. No one else, just herself, because she was completely fed up and broken by the lack of food, the lack of benefits, the lack of respect and regard that she was just receiving as a Black woman in America. And when the caseworkers actually had to call the police because they are mandated to do so, they actually started calming her down before they arrived. Even though they were not trained mental health professionals, they just knew her because they are her community. However, when the police arrived, she immediately shot back up and immediately became anxious and agitated again, and not violent, just scared. Because in her reality, she had been targeted by the police. That is how she ended up in the residence shelter. And again, the police arrived before EMTs. And she was criminalized, she was patted down and actually put in handcuffs, and they forced her to leave because they didn't have anything else for her to do. When I had asked what barriers are in place for her, and are there mental health screenings, is there counseling options, they told me no. She would have to go to the hospital and compete with thousands of other people and hope that she can get seen by an overburdened and overworked mental health professional who, they're trying their best, but she might not get the care that she needed. And this also leaves behind the children who were coming home and witnessing this. But because this was normal for them, they had no reaction to it. And to me, that is heartbreaking. And that is actually what led me to my work to pursue social work at Howard University, to operate through a Black perspective so I can better understand, to help and benefit my community. we have a mental health deficit in this city. And I'm trying to keep it short, but I did pull together a few statistics, so please bear with me. So on a national scale, between February, I cannot read my handwriting right now, but in 2023, the share of adults reporting symptoms of depression and anxiety in DC, 30.7%, the US, 32.3%. Overdose deaths per 100,000 from 2011 to 2021. DC, 63.6%, while the US, 32.4%. Opioid overdoses, DC, 48.9%, the US, 24.7%. Suicide rates, DC, 6.2%, US, 14.1%. And for DC, in terms of the need for mental health professionals being met, only 39.3%. So DC, we are bearing the brunt of a lot of the failures of the current system at play, and we have the opportunity to actually build a bigger and better system. And my ultimate goal as a DC native and someone who is still continuing to work in my city, in my home, where I, God willing, with the cost of living here, that I can continue to be in. Yes. Sorry.
Thank you so much for sharing those sobering statistics, as well as just the first person perspective that you both offered to give people insight into what is the real impact of this work, what is the real impact of the proposals that are being put forth in the community safety agenda. And so the question that I have for you just briefly is that I'm clocking the time, but I do think that it's important for people to understand what supporting the community safety working group's agenda means. What opportunities does it open up? How does it alter our realities?
It's interesting because a part of my experience in the Leadership Academy, I was able to work with 31 different cities. And 31 different cities connected me to what was happening in this country. And I saw that there is a movement, there is an awareness about CVI, community violence intervention, from a practice as an alternative. And what it means is that I have seen statistics in my city and other cities as a result of good ecosystems, good services, good alternatives, in partnership with community, in collaboration with the grassroots, the ground teams, make a change in the understanding of a different approach to doing this work. We have failed our violence as a whole, like COVID, until we understand that until we get a handle on a different strategy, we will lose that ground, we will lose that battle. So what it looks like, the result of what we're talking about, this legislation, is solidifying what we know is working. Solidifying what we know about mental health as it relates to the escalation of violence and support. Solidifying and providing resources and supports to what we know is working around intervention and prevention on the street. Having the public safety look like the violence interrupter in partnership with community. It looks like strengthening. It costs $25,000. We got a formula. The formula is for a high-risk individual, it costs $25,000 to $35,000 to potentially change the trajectory of that life. Okay, we are not getting a smidgen of that investment in our communities to make that impact. It looks like really having all of you go back to your offices, go back to your communities, and solidifying what we know is the direction that we should be going, meaning supporting what we know as an alternative. The police are not the only, it's gonna take a long time, hear me, for them to get caught up in doing it right, or figure out, because they have to dissect, understand, get at the root cause of why they're not working, okay? That's gonna take a long time. In the meantime, we're losing the battle on lives, okay? We're losing that battle on young people. We need that digital violence response. We need that innovation in partnership with young people. So it means you have to become aware, because you're not gonna get it in 3 minutes, okay? It means that you have to go back and look at and find out what is working. Call us, talk to them, Find out what is working so that you can share. Because the ground, I'm here on behalf of the 60, I have a department of 100 people who are doing this on the ground and don't have the resources to do it right. It looks like supporting them to be able to do their work to save lives.
Early passenger.
Jillian.
That was a word. But yes, like I wholeheartedly agree. We absolutely have to listen to the folks who are on the ground and doing the work. What we say at Harry's Wildest Dreams all the time is we keep us safe because we are all that we have all too often. But to me, like what this federal funding could look like, it could actually help these organizations keep their doors open. Despite the fact that HIPS is actually doing life-changing work, they are at risk of closing their doors. They are currently raising money to fund so they can actually purchase their building. In 2024, an organization that's been around since 1993 and saving lives cannot keep their doors open right now. This funding would be life-changing. It would help us in so many ways. It can help us in our schools. It can help us in our churches, our rec centers, everywhere. Helping folks get off the streets. Every single aspect of our livelihoods could be benefited by fully funding this program on a federal level. And with DC having the very unique identity of statelessness, I mean, not to plug DC statehood, but like we would absolutely benefit from having the full support of the federal government to ensure that we can actually have the full autonomy necessary to keep our folks safe. Yeah. Thank you.
Thank you so much. Can we give our panelists a round of applause? We are so appreciative for all of you who have joined in just a very generative discussion. Hopefully you've gotten information that you can take back to the legislators that you represent, but also to your communities as well. I do want to thank our panelists, our speakers. I want to thank Congresswoman Summer Lee, Michael Huggins from Color of Change, Dr. Kathy Cohen and Dr. Kumar at Gen Forward at the University of Chicago, Elena Perez and Madeline Cobb from March for Our Lives, Amir Casimir from Students Deserve in LA, Jillian Burford at Harriet's Wildest Dreams, and of course, Freedom Lisa Jones at the Center of Hope and Street Paws. I also want to thank the organizations March for Our Lives, Futures Institute under Thea's leadership, the Movement for Black Lives and Color of Change for hosting this briefing today. I do want to again encourage you to pick up the takeaways. We've got some leave behinds